All right, the purpose of this video is to go over some of the basic movements you may perform or want to put into some kind of a strength or conditioning program for the kids while you have practices. This can be done inside, outside, in a field, at a park, whatever. But they're the basic movements that pretty much everyone will do in some variation. We want to talk about two things. We want to talk about proper performance of the movement, as well as safety and modifications or scaling based on a child's ability to perform the movement. Okay, so the movements we're going to talk about today are air squats, push-ups, sit-ups, and burpees. All right, we'll probably also talk about lunges because that's very similar to the air squat and some of the things that we do. So those 5 things. Basically starting off with an air squat. The air squat focus, squatting in general, the focus should be on the glutes and hamstrings, not on the quads and the knees. Obviously those are used, but that's not the priority of the movement, okay? When we squat, we want to make sure that we're keeping our weight in our heels, all right? You can have the kids lean forward on their toes and lean back on their heels. Leaning back on your heels is what you want to feel when you're doing your squat, okay? You're going to start the movement with your hip, okay? Your feet are going to be just outside your hips, about shoulder width apart, all right? So don't squat too close. Okay, not good for the knees. Don't squat too wide. Also not good for the knees or the hips. So feet right outside the hips. Okay, weight in the heels. I'm going to start by going backwards, and then I'm going to drop down, keeping my chest up as I do so. All right, down and up. Keeping my weight in my heels, down and up. From the side, okay? Notice I go backwards as I go down. All right, keep my weight. Actually, wiggle my toes here. I don't need to wiggle my toes, but I can. And then come back up again. As far as depth is concerned, we want to get to the point where we can go to our hip crease below our knees, okay? The top of our knees. As I go down, okay, that's as far down as I need to go. My hip crease is below my knees. I don't need to be down here, okay? The further down you go in here, the more you tend to put that pressure in your knees, and that's not what we want, okay? We don't want bad knees. Some of the biggest things you're gonna see in squats for kids, okay, is first thing we have the knock knees. Right? The kids, someone will go down and they're gonna be like this. See how my knees are coming in, okay? We wanna make sure that you have them push their knees out. There should be a straight line from the knees going down over the toes as they squat, all right? If someone has a problem with knock knees or any of the other things we're gonna talk about, the idea is you want them to scale or modify to the depth that they can go before that error or fault happens. So if a child can go here before their knees start caving in, then that's where they should stop. Don't let them go to here and squat continually in a bad form every single time, okay? If this is as far as they can go before their knees cave in, then that's where they should stop every time until it gets better, okay? Another one you're gonna see, as they squat, you're gonna see a rounded back and they come down like this, okay? And this is maybe as far as someone can go without keeping their chest up and their back flat and keeping the weight in their heels. Same thing. If they can get to here, keeping their back flat and their chest up, then that's as far as they need to go. The 3 common faults we have are the knees, rounding the back, and then also coming up on the toes, okay? Coming up on the toes is really, it's a little bit difficult, but people tend to do this when they're really tight in their calves and their ankles, all right? Or they're just not used to sitting back because they do this and then they feel like they're gonna fall over. So they get up on their toes. As soon as you get up on your toes like this, you're making your knees the focus, and that is not something that we want to do, okay? Again, the hips and the glutes should be the focus for everything as you come up and down, okay? So the 3 things you're going to see on air squats, so you want to try to prevent. Don't let the children go to a depth or continue doing the reps, all right, if they're not doing them properly. Decrease the depth, change the movement so that they can perform them correctly and safely, all right? Knees in, we don't want that. Knees out, all right? Don't let them come up on their toes when they're squatting, okay? Stay back in their heels. And then when they're going down, make sure they keep their back flat. They don't round over like this as they're squatting, okay? That's the air squat. All right, the next thing we're gonna talk about is the push-up. The push-up, the most common thing we see with the push-up is not keeping your core engaged, so you have an arched back, right? Sticking the butt out, letting the rib cage come out like this when they're on the ground, or letting your elbows flare out when you're doing the push-up. So The proper push-up, I'll go both directions. Okay? You should have your elbows, elbow pits where your arms bend, should be facing as far forward as possible with your fingers facing forward. As you go down, you want the arms to go generally backwards. We don't want them going outside like this. We definitely don't want hands turned in, so when they're pressing like that, we don't want them super wide, going elbows out, okay? Those are all things that are going to force that movement into the shoulders. We want the pecs and the triceps to be the focus of these movements, okay? So, in a good position, hands about shoulder width apart. In a good plank, elbow pits forward, down as one piece, up as one piece, okay? From the side. Watch how my elbows start off at a level line with my shoulders. As I go down, they go to my lower chest. Elbows go back, okay? We don't want to see kids like this, hitting with their thighs or pelvis to the ground first, and then their chest, right? Or coming up in two pieces like that as well, okay? We don't want to see arched backs. Roll there, squeeze the buttocks, squeeze the abs, keep the rib cage down, body flat, down, up. All one piece, okay, as much as possible. All right, your scales for the push-up, okay? Two things we can do. One, we can go to the knees. All right, everything else stays the same. Keep your body straight, squeeze your butt, rib cage down, down and up, down and up. All right, something else that we can do is you can get a bench or a box or a log or a chair, a car fender, whatever it may be, right? And you can bring the ground up to make it easier to maintain that full body plank. Okay, but it makes the actual push-up easier. So they maintain the same position as if they were on the floor, but when they go down, they don't have as far to push from the floor, okay? And you can go up all the way up to a wall. If you need to do a wall press, you can do that as well. Okay, the biggest things with push-ups as far as injury concern is the shoulders, making sure that the shoulders stay tracking close to the body, and making sure that the lower back does not arch, so there's no lower back pain and impingement while they're doing that, all right? So remember, the push-up is just a plank, so have them get into a good plank first and go down as far as they can. Ideally, we want them to go down to the shoulders past the depth of the elbow, and that's a good push-up. All right, now we're gonna talk about the sit-up. The sit-up has a lot of different variations, and we're just gonna talk about a basic sit-up, the standard sit-up you see with your laying on your back with your knees bent and your feet flat on the floor. This is all right. We're gonna cross our arms over our chest. I don't want you having kids put their hands behind their head, because what happens here is when they start to pull up, they tend to wrench on their neck and pull with their arms more than they're lifting with their core, okay? What we want is we want them to put their arms across their shoulders like this, their chest, so when they're lifting, they're actually using their abs to lift up, okay? You can do it where they're having a partner push on their heels to give them leverage or not. That's completely up to you. The biggest part is when they're doing this, make sure they're not pulling with their head, all right? When they come down, make sure that they're not slamming down and they're keeping their chin tucked into their head so they don't hit their head on the floor or the ground or the grass or whatever it may be, okay? So the sit-ups are pretty basic. There's not much of a risk for injury there other than pulling, and that's more of a repetitive thing. Eventually that will cause an injury or hitting their head on the floor. All right, we're gonna talk about everybody's favorite exercise now, and that is the burpee, okay? The burpee is a multi-use exercise. It's primarily used to get the full body working. It's a great warm-up exercise. It can also be a great conditioning exercise, okay? The burpee is a combination of movements, and it's basically hinging at the hip, like you're starting a squat, and with a kind of a push-up motion as well. So a full burpee looks like this. Okay, I'm bending at the waist. I'm putting my hands flat on the floor. I'm kicking myself back, and then I'm laying down. I'm going to squeeze my glutes, push my chest up and snap till my feet come up behind my hands, and then stand and jump. Okay? So all together again. Hands to the floor, kick back, lay down, kick up, feet behind my hands, and jump to the sky. All right? That movement can be scaled in many different ways. The first way is that if someone has an issue kicking back or if they're squatting down a lot, okay? What I want you to think about is bending at the waist, you're bowing down, putting your hands on the floor. They can step back. They can go to the floor, then they can step up, stand, and jump, okay? You don't have to jump. If you have a kid who's got an injury, maybe they can't have impact, so there's no jumping. They can step, and then stand, all right? They can go down all the way. Say they have something going on with their back or there's something else going on, and this is all they can do. That's perfectly fine as well. Okay, that's more of a stepping squat thrust than it is a full burpee, but it's a modification in the scale that perfectly works that situation, okay? Just like the bench press we talked about earlier, you can pull up a bench, and they can do that same thing, down to the bench, step back, step up, and stand, all right, if they can't go all the way to the floor. All right, we're gonna talk about lunging next. Lunges are similar to squats in that the focus is really in the glutes and the hamstrings. You're definitely going to get some quad work, but a couple of things that we see a lot with lunges is people tend to go short with their lunge, okay? Or they tightrope. So when tightrope, you're really close together with your feet. So a proper lunge is gonna look like this. I'll do 2, knee to the floor, step through, knee to the floor, all right? From the side, okay? Knee to the floor, step through, knee to the floor, okay? If you'll notice while I'm down here, my shin is mostly vertical, all right? There's a space between my heel and my knee that's about the same distance as the length of my foot. If I take my foot here and put it here, it's that same thing, okay? From left to right, if I step forward, you'll see this line, if I bring this foot straight up, it's the same distance as the distance that I've had my feet when I squat. Okay, so what we're looking at is making sure that we have a wide enough base to control the work that we're doing. So step number 1, step out long enough, okay, long enough that when I drop this leg straight down, because it's all about the back leg down, okay, there's that space between my knee and my heel. Don't let them lean into it like this. This is not what we want. Just like the squat, this is putting all the pressure in the knee. I'm using my toes, not my heel. In the front foot, all the weight should be in the heel, okay? Driving the heel through and coming up. Second thing, make sure they step off to the side a little bit so there's that distance, that space left and right. If they tightrope, they're gonna fall over, okay? They're not walking a tightrope, okay? Again, if somebody has a problem going all the way down and we have to modify, they can go to here and then come up. Go into the next one, go to here, and then come up. You do not have to make them fully execute movements if they can't do them properly for injury or ability, whatever the sake may be, okay? Be flexible, try to be a little creative when it comes to scaling and modification. Think about what are you trying to get out of the workout and give the kids options based on their current ability, okay? Just remember, try not to have them repeat things consistently if they're not doing it properly, and don't ask them to do something their body's not ready to do yet.